Hello and welcome. Today we're delving into a heart condition known as progressive cardiac conduction disease, also sometimes referred to as Lenegger disease or Lenegger disease. We'll explore what it is, what causes it, how it affects the heart, and what can be done about it. Progressive cardiac conduction disease, in many cases, arises from genetic mutations. Certain genes responsible for the electrical signaling pathways within the heart can be altered, predisposing individuals to this condition. However, it's important to note that, in some instances, the exact cause remains unknown. In these cases, we refer to it as idiopathic. The heart relies on a complex electrical system to coordinate its contractions. In progressive cardiac conduction disease, this system gradually deteriorates. Specifically, the disease affects the specialized tissues responsible for transmitting electrical impulses, such as the bundle branches and the His-Purkinje network. As these tissues become damaged or fibrotic, the electrical signals are slowed down or blocked altogether. This disrupts the heart's rhythm and can lead to various heart blocks, where the atria and ventricles beat independently or at different rates, ultimately impairing the heart's ability to pump blood effectively. Progressive cardiac conduction disease is relatively rare. Its exact prevalence is difficult to determine, as many individuals may be asymptomatic for a long time. It tends to affect older adults more frequently, although genetic forms can manifest earlier in life. There isn't a significant difference in occurrence between men and women. Many individuals with progressive cardiac conduction disease may not experience any symptoms, especially in the early stages. However, as the condition progresses, common symptoms can include dizziness, lightheadedness, fainting spells, or syncope, shortness of breath, fatigue, and palpitations or the sensation of a skipped heartbeat. In severe cases, it can lead to sudden cardiac arrest. Diagnosis typically involves a combination of techniques. An electrocardiogram, or ECG, is crucial in detecting conduction abnormalities such as bundle branch or AV blocks. An electrophysiology study, or EPS, may be performed to further evaluate the electrical activity of the heart and pinpoint the location of the conduction block. In some cases, genetic testing may be recommended to identify specific gene mutations associated with the disease. Holter monitoring, which involves wearing a portable ECG device for 24-48 hours, can help capture intermittent arrhythmias that might be missed during a standard ECG. While progressive cardiac conduction disease doesn't have distinct subtypes in the traditional sense, the severity of the condition is often categorized based on the degree of heart block. These range from first-degree AV block, which is typically benign, to second-degree AV block, which can be Mobitz type I or Mobitz type II, and finally to third-degree or complete heart block, which is the most severe form. The primary treatment for progressive cardiac conduction disease is the implantation of a pacemaker. A pacemaker is a small device that's surgically placed under the skin and connected to the heart via leads. It monitors the heart's electrical activity and provides electrical impulses to stimulate the heart to beat at a normal rate when it senses a pause or a slow rhythm. Medications are generally not effective in treating the underlying conduction defect itself. Lifestyle modifications like avoiding excessive caffeine and alcohol may be recommended to help manage symptoms. Because many cases are genetically determined, prevention, in the strictest sense, is not always possible. However, early detection and management of risk factors for heart disease, such as high blood pressure, high cholesterol, and diabetes, may indirectly help to reduce the overall burden on the heart's electrical system. Genetic counseling may also be beneficial for individuals with a family history of the condition. The prognosis for progressive cardiac conduction disease varies depending on the severity of the condition and the presence of other underlying heart problems. With appropriate treatment, particularly pacemaker implantation, most individuals can lead relatively normal lives. However, close monitoring is essential to ensure the pacemaker is functioning properly and to detect any new or worsening arrhythmias. Research continues to focus on understanding the genetic basis of the disease and developing targeted therapies to slow down or prevent the progression of conduction defects. Gene therapy is a potential future avenue for treatment.